Well, imagine walking into work one day and facing a life or death situation. What would you do? Well, back in February in 2014, our next guest did just that. And a warning, this clip we're about to show you is pretty confronting. What you just saw there was the exact moment spinal and neurosurgeon Dr Michael Wong was dragged to safety by his colleagues after being stabbed 14 times by a mentally ill man. He joins us now. Please welcome Dr Wong to Studio 10. Hello.
Yeah.
First up, that video is pretty confronting. We couldn't show too much of it, but was there a point during the attack where you thought, maybe I'm not going to survive this? What was it like being stabbed 14 times?
Oh, it's painful to start off with. Yeah. And firstly, I must apologise.
People often say it's like being punched. Is that true, that the sharpness of it you don't feel?
First, I just want to apologise for this sort of horrific scenes on Breakfast TV. But you know, it's not actually pain. It's, you know, you don't feel pain. It's just the rush of adrenaline. You know that you're being attacked. It's almost like being attacked by a wild dog. You know, you just want to get away. You don't feel pain. You don't think about whether you survive or not. You just want to get away, and that's the instinctive reaction.
Is it hard for you to watch that back?
I actually never watched that before.
Is that the first time you've seen that?
And what effect did it have? How does it make you feel?
Kind of a bit silly, isn't it?
Oh, no, no.
Horrific. It's terrible.
You were dragged into the operating theatre for 10 hours of surgery, but for you, one thing was crucial, and that was your hands.
No, it wasn't.
Oh.
That was
I've been
afterwards.
misinformed.
Oh, right, this is after you recovered.
Yeah, but you mean, when you face this sort of severe, significant attack, you just want to survive, you just want to get away.
Right.
Yes, afterwards, you know, once I recover, I realised that, well, yes, you know, I'm alive, I've got my function back, and obviously then you want to get the full function back in order to go back to work.
Your job.
And of course, to be a
Yeah, of
neurosurgeon, you do need your hands. Can we have a look at them, because did you
Sure.
put them up and they were you used them to protect yourself, didn't you?
Yes, because like any knife attack, one of the silly things that we instinctively do is to throw our hands up.
Yeah.
And that's a bad thing to do for a surgeon, because you get your hands cut. And I remember as I was dragged away, I look at my hand and say, gee, that's a bit of a mess, you know. And
God almighty, it's hard to even imagine. You suffered all these terrible injuries. How do you feel now about that moment and the person who attacked you? We know they were mentally ill. Do you see them as an enemy or as a potential patient, or how do you feel about it?
Well, not an enemy, no, not at all. The attacker was a mentally ill patient. He was a refugee. He came from a war-torn Middle Eastern country. He can hardly speak English. He's only been in Australia for a few years.
Yeah.
You know, when you put people in that sort of situation, it's very, very difficult. You know, they go through hell in Australia to try to create a life for themselves. I wasn't born here. I was born in a different country. I know how hard it is. But I think, you know, it's not, you know, anger. You know, obviously, you know, what he did was wrong.
Yeah.
But, you know, he needs help. Simple as that.
What
So
actually
you
happened?
You just see him as a person that needed help.
Absolutely.
Yeah.
It'd be like, you know, we have all these terrorist attacks these days all around the world, and most of them have mental illness.
Have you seen him since?
I saw him in court.
Oh, right.
Yeah.
What happened to him?
He's been sentenced to a psychiatric institution. for
Were
treatment.
you treating him? How did it come that he
He was one of the
attacked you?
hospital patients.
Right,
Yeah,
but not your patient. He
I might
just-
have come across him in the past.
Right.
And but you know, because of the volume of patients that you treat in a public hospital, you don't know.
So you were just unlucky. He just randomly attacked you.
Yeah.
Yeah. Wow.
Well, I understand because he was obviously behaving erratically, and you were sort of trying to calm the situation down, or was it just something that just came out of nowhere?
No, it came out of nowhere. I was just walking to work, and then he attacked me from behind.
Wow.
Have you had any lasting effects from this attack?
I got back pain.
Back pain, chronic back pain.
Yeah, well, because the worst injury, if you like, was through my back. And fortunately, I can still walk. Because at one moment, they thought that I may not be able to walk anymore.
Oh.
Yeah, but yeah.
What sort of back pain, and how does it impact your life every day? I mean, are you in pain now?
Not talking to you.
Thanks, Dr. Wong.
You're
pain relief.
But you know, it's just like a lot of people, they suffer chronic back pain for
Yeah.
various reasons, especially if you have some sort of injury.
Does it stop you from doing things day to day in life?
Definitely, I changed the way I do things.
Yeah.
You know, I don't want to do a lot of things all in sort of one hit. I want to space them out and have breaks in between and do more exercise and keep the back pain under control.
Are there other ways to manage back pain that we perhaps don't think about that you
know,
use? I mean, are you on painkillers or
No.
no painkillers? So you just manage it through exercise?
I think painkiller is being, you know, overused for treating chronic back pain.
Yep.
I mean, you know, would you take painkiller if you have a toothache for 3 years? No, you won't. Because you want to find out what the cause of the problem is. You know, painkiller is a short-term treatment, right?
Yep.
So when someone has chronic back pain, you've got to really look for things which is non-medication. You know,
One of the
It's
things
so
mentioned-
interesting, the cognitive
Yeah.
behavioural therapy, which is often used to treat anxiety and depression, you're saying can be a really important tool for managing back pain. In what way?
Well, I think that is the last resort for someone that has back pain and has been investigated, and we can't remove the source. So basically, you're telling the patient that, well, nothing we can do about that. We can manage the pain, but one way to manage apart from medication exercise is that for you,
Positive.
for you to just change the way you think and how you face the pain. And that is part of the way to deal with a chronic situation where you can't change.
Is some chronic pain psychosomatic? As people get so used to the pain that they think it's there even if it goes away?
Yeah, I think so, but you've got to be a bit careful. That's a bit crude. Some doctors do that, basically saying to the patient, it's all in your head.
So, yeah.
Yeah.
Okay, hang on a
Particularly
second.
women.
It's not really. in
No,
your
women
head.
particularly get told that
Okay.
a
Right.
lot.
I'll be
The
careful.
thing is, you can see how if you've got a negative, if you're in pain and it makes you negative, then the negativity is going to cause more pain. It sort of works like that. But if you're positive, you can try and feel good about it. You even carry yourself differently if you're positive. If you're negative, you're down like this.
There's something about back pain, though, don't you think? I mean, I've had and it's not lasted for any more than a few days, and it just wears you down to have that constant gnawing pain that you carry.
It must be terrible.
I don't know
for
how
people.
people live with it every day. It's a really grueling thing to have to face.
But you've overcome everything. Back at work, looking after people. So you've done it.
The assumption is always that life isn't perfect. You can always make it better.
Right.
Yeah, okay. So you always try to do better each day, right?
Right.
Okay.
Right.
Well, you are absolutely inspiring. It's been lovely speaking with you. Dr Michael Wong, everyone.
Thank
Right, thank you.